COVID-19 patients aren't the only ones needing hospitals, but hospital officials say a lot of people who may have usually come in for treatment have been staying away during the pandemic. 25 News reporter Olivia LEVADA shows us what they're doing to eliminate fears.
Todd, abdominal blockage sent one Central Texas woman to the hospital, but because of COVID-19 related concerns, she waited a while before actually checking in. When Cassie Wright felt ill a couple weeks ago, she almost decided not to go to the hospital because of COVID-19.
I was just more so worried about the patients out there having COVID-19, and I didn't think that my issue was that big a deal.
However, after days of abdominal pain, she finally decided to stop by Baylor Scott & White Medical Center, Hillcrest.
And the doctors told me that I had to have emergency surgery right then and there.
A decision her nurse, Ryan Lundgren, says made quite the difference.
Ignoring things don't make it go away, it just makes them worse, usually. In her case, it definitely got worse. When she finally came and started getting care, that's when we started to turn things around.
Emergency Department Director Dr. Joshua Hauser says Wright is not alone. A number of patients are not seeking care right now.
So across the country, you're looking at about 60% of normal volumes in emergency departments. So at Hillcrest, we see about 200 to 220 a day was average until 8 weeks ago. And right now we're seeing 80 to 110 a day. So about 50%.
But he says you shouldn't feel discouraged to check in. The team has taken a number of steps to ensure the safety of all patients.
Everyone's wearing, like I said, masks, goggles, full gowns a lot of times. Respiratory complaints in one area, non-respiratory, non-COVID-like complaints in other areas.
And even Wright has learned when it comes to seeking help, better safe than sorry.
I felt really privileged to be there. They were very safe. They had gloves on. Mask.
Dr. Hauser says whether they're treating COVID-19 patients or not, hospital staff wear masks at all times. Olivia LEVADA, 25 News.